The next procedure is the Lgcp, or the laparoscopic greater curvature plication. As I mentioned before, this currently is only a self-pay option, but is still an option that we provide. This is a restrictive procedure. There is no malabsorption with an Lgcp. Watch this short video of how an Lgcp is performed and may help you lose weight.
Laparoscopic greater curvature plication is a restrictive procedure which limits the amount of food you can eat by reducing the size of your stomach. To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. A laparoscope or video camera is used to visualize the surgical area. During Lgcp, attachments to the greater curvature of the stomach are removed to facilitate future plications. The next step in the procedure consists of starting an inward fold of the stomach and securing. The final step in the procedure is another inward fold of the stomach, similar to the previous step. Upon completion of the Lgcp procedure, the gastric capacity has been significantly reduced. Patients are placed on postoperative diets similar to other bariatric procedures. This includes starting with liquids and progressing to solids over several weeks as tolerated. As with all weight loss procedures, behavior modification and dietary compliance plays a critical part in determining the long-term success of the procedure. All surgery presents risks. Weight, age, and medical history determine your specific risks. Ask your doctor if bariatric surgery is right for you.
So what are some of the advantages and disadvantages of an Lgcp? Advantages: there's no removal of the stomach. There's no stapling of the stomach. And so therefore, leak is pretty much non-existent. You do have appetite restriction. You will feel full quicker, which will help you lose weight. There's no foreign bodies placed in an Lgcp. There's no malabsorption or dumping in an Lgcp. There is very low risk for protein or vitamin deficiencies in an Lgcp because, as I mentioned, there is no malabsorption created. Lgcp does have the option to be converted as a two-stage procedure, meaning if it was not effective enough for you, we could convert that to another option if needed. What's some of the disadvantages? As I mentioned before, it's investigational. We know less about an Lgcp compared to these other procedures that we offer. One big disadvantage, obviously, is it's only self-pay. Currently, right now, no insurances will cover Lgcp. It's not reversible, and you will have full absorption of all your foods. As I mentioned before with the band, if you choose the wrong foods or high-calorie foods, it will negatively impact your weight loss.